This morning, we are kicking off our special series, Heroes Among Us, with our sponsor, Johnson & Johnson. All year long, we're going to be highlighting healthcare heroes and the incredible, often unsung work they do.
And this first story is a really important one, just in time for National Black Maternal Health Week.
Yes, so many high-profile black women have been very open about their difficult experiences with pregnancy complications, including Olympian Allison Felix and tennis star Serena Williams, who recently said she saved her own life after she says doctors failed to listen to her during the birth of her daughter. I had the chance to meet one incredible woman on a mission to improve outcomes for black mothers in her community and beyond. Do you know how many babies you've helped deliver?
No. I stopped counting a long time ago.
Is that high that you've stopped counting?
Yeah. It's been thousands.
For certified nurse midwife Ebony Marcelle, delivering babies is more than a job, it's her calling.
I've been obsessed with pregnant ladies since I was like 4. Oh, you just flipped around.
Ebony is part of a new generation of midwives, pushing back on popular misconceptions about the profession.
The difference between an OBGYN and a midwife is, number one, midwives are not surgeons. Our philosophy on birth is more so that it's not a disease or a medical condition, but it's a normal life transition. Our concept is believing that this is a holistic experience.
Ebony was inspired to take action during childhood when she witnessed firsthand her family's difficult experience with the healthcare system.
We had to go at times to the ER. And I remember the healthcare providers that treated us like trash because they knew we were using public assistance versus the providers that didn't.
So Ebony used her experiences to fuel her passion, becoming a nurse and hoping to provide her patients with the kind of care she says her family didn't get.
It did really, really motivate me to make sure that when I'm providing care, I'm providing good care to everybody, no matter their background, no matter where they come from.
And then an experience at a doctor's appointment changed her life.
The person had given me more time and asked me things people had normally never asked me. And I was like, why is this so different? And she was like, oh, because I'm a midwife.
Ebony went back to school to study midwifery and focused her work on racial inequalities in maternity care. According to the CDC, in 2020, 861 women died from maternal causes in the U.S., most of them from preventable issues. And black women are 3 times more likely to die than white women, something Ebony says leads people of color to distrust the healthcare system.
Currently, the way our maternity care system is set up, everybody is kind of treated with the same kind of cookie cutter care. And the problem is when you're dealing with communities that are filled with food deserts, high rates of violence, histories of trauma, that care is not fitting for them.
Today, Ebony is the director of midwifery at Community of Hope Birth Center in Washington, D.C., one of 5 federally funded clinics serving a majority Medicaid population.
Gorgeous!
Here, caretakers give individualized hands-on care in redesigned birthing rooms.
Our rooms look like a home. It's such a great experience if you want to move away from more of the standard medical experience.
You also do work with hospitals if that's what a couple chooses.
We're able to offer the families that we take care of hospital birth or birth center birth.
Ebony says her approach is designed to build trust.
I definitely feel seen by the midwives here.
I'm thankful that I was able to have all my children with the birth center and with the midwives. It's made all the difference.
A difference that can be seen on the faces of the patients and employees that Ebony inspires every day.
If I were to ask you about a takeaway for this just topic in general in black maternal health, what would you say?
Listen to black women. We're out here. Listen to what we have to say.
There are many efforts being taken to combat the problems in black maternal health care. Listen to this. A recent study from the University of British Columbia showed that Ebony's approach may work. States where midwives could more easily practice had fewer preterm births, underweight newborns, and surgical C-sections. And we should mention our sponsor, Johnson & Johnson, introduced us to Ebony through their Nursing Leadership Fellowship. We get so many emails and we get messages from all sorts of people who are making a difference around this country. So this is a really nice way to spotlight heroes like Ebony who are certainly moving the needle.
And it's interesting because so many people have babies. It's like, okay, everybody's having babies, but you need to be monitored. Everyone needs to be watched so closely because every situation is different.
Yep.
And it makes a difference.
And even after you have the baby.
Sure.
You know what I mean?
The midwifery has been around for so long, but has really come to the fore now.
Yeah, and I think it's coming back. I
Yep,
think more people are
absolutely.
appreciating
That's great.
it. All right.